Dr. David, thanks so much for having a chat with us.
Thank you for having me here.
Now, we just want to find out more about Janice's case. So tell us about your initial consult with Janice. What happened? What were your findings?
So Janice came to me earlier on this year, and she actually had a condition called glaucoma.
Right.
She had a very specific form of glaucoma, which was due to the fact that she's had a very long-standing problem with one of her eyes. There was constant inflammation, which needed steroid treatment, and therefore the combination of long-standing inflammation and also steroid use had put the pressures inside her eye very high. So when you have very high pressures in your eyes for a prolonged period of time, it will damage the optic nerve at the back of your eye. So the optic nerve is like a cable connecting your eye and your brain. When it gets damaged, you will start losing vision, initially in a peripheral fashion, which is not usually noticeable. And then if left long enough, it will cause blurring or loss of central vision. And the problem with glaucoma is that it's not reversible. So for Janice in particular, she had lost a little bit of her vision. Pressure was very high, and she was already on quite a few eye drops. So there were not really any more eye drops we could give her. She was also on some tablets to bring the pressure down. These tablets are very effective for pressures, but they cause a lot of side effects in terms of nausea, abdominal pains, just general drowsiness and tingling in your hands and feet. So she was not in a good shape when I first met her, and the only solution forwards really was a fairly major procedure to reduce the pressure in her eye by increasing the draining of fluid from inside of the eye to outside of the eye. And this was called a glaucoma drainage device, or an aqueous shunt, and it's also known as a glaucoma tube.
Is this procedure standard for all glaucoma patients, or is Janice's case slightly unique?
So Janice was a fairly advanced case of glaucoma, and this procedure, there are several schools of thought. Sometimes we can use it as a primary procedure, primary meaning we go straight for it, but this tends to be reserved for a kind of glaucoma called secondary glaucoma, where the glaucoma is due to something else affecting the eye. And the reason why we go for this over other operations is because in secondary glaucomas, for example, other operations may fail a little bit more quickly. So it's a matter of trying to get it right first time for the right patient.
What do you mean by failing quite quickly?
Sorry, yes. So with other glaucoma operations are aimed at trying to increase flow of fluid from inside of the eye to outside of the eye, and the eye will constantly be trying to remodel itself and to heal itself. So if you have excessive healing, it can actually lead to a blockage of the flow despite our best efforts, and that's what we mean by an operation failing. It means that whatever procedure we've done is no longer draining because of scarring on the outside of the eye.
Okay, excessive healing. Wow, that's an interesting word, because I thought healing was just healing.
Correct. So in glaucoma, it's all about balance. We don't want too much of something, we don't want too little of something, and it's the same with pressure and scarring and healing. And it's a constant battle with the eye to try to control the amount of scarring and healing, although this is a very natural thing the eye tries to do, and that presents some of the challenges that we face as glaucoma surgeons.
So 10 years ago, Janice told us that she had faced this inflammation in her eye and whatnot, and she's seen multiple doctors about it. Had she seen you, let's just say 10 years ago, would your diagnosis would you have done something different for her?
I think it's very difficult to go back and retrospectively rely on hindsight. It may well have been that 10 years ago the pressures were not actually that raised. The optic nerve, the nerve may not have been that damaged. And so therefore 10 years ago the eye may have been in a much better state than it was now. But you know, it's very hard to go back and try and work out what exactly happened.
Right. I'm just wondering, because had it been 10 years ago, that means the procedure that you had to go through now would not have been so as complex, I suppose.
The procedure in the form that we used for Janice, it was already there. The procedure was already quite well established. So yes, I think the procedure in Janice's case was done at the right time. So we only do something if we need to intervene, if we feel that there is a loss of vision, and especially if we feel that the benefits of doing something outweighs the risk, and that applies to all surgical procedures.
Right. Now tell us a little bit about glaucoma, because a lot of people mix it up. When people say you're getting older, or cataract, or no, not glaucoma, they always just throw these two terms around like it's nothing, but it's very different. So what is glaucoma?
So glaucoma is a very important condition. This is actually, if you look on the World Health Organization website, it's actually listed as the second most common cause of blindness in the world after cataracts.
Right.
The problem with glaucoma, so there are a lot of different kinds of glaucoma, of which Janice's is a small part of it. But glaucoma generally, in a lot of forms, has no warning signs. There are no symptoms in the early stages. So there's no way for the patient to tell the doctor that they have a problem. What happens in glaucoma is that the nerve gradually and silently and progressively gets damaged. And this leads to a loss of vision, in most cases in the far peripheries to begin with. And if left long enough, it will lead to tunnel vision.
Right.
And even when you're at the stage of tunnel vision, a lot of patients actually don't find that there is a problem, because we don't realize that the central vision that we use is actually only a very small part of our entire visual field.
Oh, yeah.
So in areas like Asia, where there may not be screening procedures in the community, patients only come to us when they've started noticing blurred vision or loss of vision from glaucoma, for example, and usually they are very surprised to find that they've lost about 80 to 85% of their vision already, irreversibly. So the main thing about glaucoma is it's silent, and if it's not screened and picked up early on, it can be a very devastating issue for
Meaning
patients.
There's no treatment available for that.
Correct. So once damage has happened to the nerve and visual loss has recovered, we cannot reverse the loss of vision. We cannot regenerate the nerve, not currently anyway. And the aim of glaucoma is always to prevent loss of vision in the patient during their lifetime. And this is usually done by reducing the pressure in the eye. So particularly if, for example, you have family members who've been affected by glaucoma, if you're very, very short-sighted, for example, these are some of the risk factors for glaucoma. And it's good to get screened, really. The screening is the only way we can more or less pick up glaucoma at an early enough stage to be able to diagnose and treat early and prevent loss of vision.
So wait, it's hereditary in a way?
Some forms of glaucoma are hereditary, and in some families it can run in a very strong fashion. A lot of glaucoma isn't. It's actually just spontaneous. The biggest risk factor is actually increasing age. Right. So if you're past a certain age, it's generally just good to get an eye examination to look for, amongst other things, glaucoma, for example, cataracts or any other issues. Because the crucial thing to remember is a lot of eye conditions actually have no warning signs in the early stages. And when they reach the later stages, it's very hard to sort of retrace our steps and make it better.
But when you say there's no warning signs, that means one day I'm seeing everything fine. Next day I'm feeling like this pain in my eye and I lose vision?
In a lot of long-standing but serious conditions, for example, glaucoma or diabetes affecting your eyes, it doesn't actually cause a painful loss of vision. Usually the vision will gradually get worse and worse over time without any pain or any other things to alert the patient that there is an issue.
Right.
If there is pain, usually they will come in and we can see the problem. There is a trigger for them to see us.
Right.
Whereas if everything was painless and there was no other issues, people generally assume that everything's okay, which may not necessarily be the case.
Because most people just think, I'm getting old, that's how it is.
Correct.
Right.
Correct.
Now, so tell us about a procedure that you did with Janice, because hers was slightly unique, and you mentioned, like, as far as I know, cataract is just the lens trying to either replace it, glaucoma is increasing pressure. in this case, it's not just like changing the HDMI cable, I suppose, right? I'm guessing.
I wish it was that simple.
Right.
So in order to reduce the pressure in Janice's case, we had to insert a little silicone tube that goes into the chamber at the front of the eye. So it has to go into the eye, and then further back there is a little plate that disperses the fluid towards the back of the eye.
Okay.
And on top of all this, there's a covering of the eye, a bit like a blanket that goes all across. In short, that's how it works. It's a little straw drawing fluid out from inside of the eye to outside of the eye in a controlled fashion.
Right.
In a controlled fashion.
And the fluids will never build up again. You never have to do this procedure again. It's a one-time deal.
In medicine, we never say something is forever and is guaranteed. So there are patients who the initial procedure works well for a long time. There are also patients where the procedure starts to work less and less well,
Right.
in which case other options may have to be discussed with the patient, including further surgery.
Okay. So, for the general public who generally don't take good care of their eyesight anyway, I'm guilty of that. How can we take better care of our eyes to make sure that we stay clear of glaucoma?
I think, so if you have family members who've lost their vision for whatever reason, it's good to get yourself screened for serious eye conditions. I would advocate doing everything in moderation, having a healthy diet generally, keeping up with your exercises. But the main message I think we need to get across is that we don't really have screening procedures in Asia particularly. We are seeing eye diseases present or come to us very late in the process. So it's a general awareness that actually if everything seems to be okay, it probably is. But until you have it checked out or screened or examined, it's very hard to tell sometimes. And we've had patients who have come in with no issues, and we've actually picked up problems that we needed to get on and treat, thankfully.
Right. So when you said in Asia there's no way to screen it, so I can't just go over to I'm buying new glasses and I just maybe increase the power. I can't go and check it and they say, hey, you've got glaucoma. It's not as simple as that. We need to come over to the place at ISEC to get it checked.
Not necessarily. So there are opticians in the community in Malaysia who actually do a very good job at screening. So they will, for example, try to check your pressures in your eyes. They'll try to have a look at the nerve at the back of your eye. But not everybody does that. Whereas, for example, if you compare to the United Kingdom, most opticians will actually screen, for example, for glaucoma. And if they find something that they are not entirely happy with, they will refer on to the hospital system. So when I was in the United Kingdom, I noticed that we were picking things up a lot earlier because there was just widespread screening in the community. And then in Asia, I tend to see them coming in a little bit later during the disease process.
Right. What do you wish people would do better with their eyesight to protect their eyesight? That sometimes you see, oh my goodness, what are they doing? They're scratching their eyes, they're rubbing their eyes and stuff. I know it's a business for where you are, but maybe you might not want to see them come to see you anytime soon because it's their eyesight. What advice would you give to these people about taking care of their general eyesight? Not about glaucoma, just general eyesight.
I think do things in moderation, have a healthy diet, exercise lots, don't smoke, and that's about it. If you the other thing is if you do wear, it's a different topic altogether. If you do wear contact lenses, you have to be very careful with cleanliness, not over wearing the contact lenses. And many people are not aware that we do not actually encourage you to swim or shower in the contact lenses.
Right.
Because that can lead to fairly severe infections of the eye.
What about people like me who are supposed to wear glasses but we hate wearing glasses?
It depends. If you have a significant prescription or power in your eyes, then we would generally advise you to wear spectacles or contact lenses as much as you can to get the best possible vision to do what you need to do.
Right. And avoid me on the streets while I'm driving, basically. Dr. David, thanks so much for chatting with us.
Thank you so much for having me today.